Thanks for joining me again today. Trump administration decisions continue to negatively impact both our local and national economy. The stock market dropped this week on news of these newly enacted tariffs, which will likely increase inflationary pressure and the cost of goods. We continue to see mounting layoffs of federal workers, contractors, and others who count on federal funding. This week, our HHS department joined the County Council on a webinar focused on mental health resources and support. As I've mentioned over the past weeks, this is a very stressful time for families, and we want to make sure that anyone struggling should contact our crisis center, which provides crisis services 24 hours a day, 365 days a year. Services are provided by telephone 240-777-4000 or in person at 1301 Picard Drive in Rockville. No appointment is needed. And if you need to talk, the 988 Suicide and Crisis Lifeline is open to you. Call, text, or chat for skilled, judgment-free, confidential conversations. We also want to make sure that if anyone has lost health coverage from your job, they have 60 days to apply for coverage on Maryland Health Connection, the state's official health insurance marketplace. This may be an affordable option instead of COBRA, and it's also an option after the COBRA period ends. If you have not enrolled in COBRA, you may find that coverage through Maryland Health Connection is a more affordable option. Visit marylandhealthconnection.gov to enroll or find free help near you, or call 240-777-1815. You can also download the free app at Enroll MHC. The Montgomery County Council is now considering various housing proposals, some from the Planning Board, which I've been critical of, and most recently, the More Housing Now package of proposals. The More Housing Now plan does have some good ideas in it, including the need to change workforce housing practices and policies and to expand homeownership opportunities. So I appreciate that part. The parts that concern me with both ZTAs and the University Boulevard Corridor Plan is that these processes disregard community planning. Between this and the corridor plans, the Planning Board has abandoned the master plans, which were products of processes that until recently involved substantive and meaningful consultation with residents who served on master plan committees and actually voted on the proposed plans. That no longer happens. Our county has a long tradition of community-based planning where communities participated in planning decisions, but that's not happening in a meaningful way anymore. I participated in one of those processes when I was a community activist probably over 20 years ago. I served on the committee that created the Silver Spring CBD sector plan. Leaders then did not try to cut residents out of the process. They appointed residents with different opinions, along with business owners and developers, to serve on these committees. And we worked things out. No one got everything they wanted, but they produced plans where everyone knew that they were involved in the process. And at a basic level, people pick neighborhoods to live in because they like the things that are in their neighborhood. They like the tree cover, the access to parks or amenities. They like the traffic conditions, the lack of congestion, the fact their kids can go out and play in the street, the types of homes. All these things go into factoring into why a person decides to move into a neighborhood. They made these long-term investments, not just as financial investments, but because they found places where they wanted to raise their families. They relied on the certainty of master plans that these were meant to be how their communities would continue to look. Now they have no idea what will happen to their neighborhood, no certainty that the quiet tree-lined street that they chose to live on will continue to be that. We need to put the community back into the planning process, and we need to do it through the master plan process that involves the community, gives them a say in the process that goes beyond putting a sticky note on a board that everyone knows will have little or no impact on the decisions of planning staff or the board. In a real planning process, there would have been involvement from county departments regarding transportation, environmental impacts, stormwater, tree cover, school capacity. All of this stuff would have been evaluated. If they'd contacted our housing department, they'd have known that there are serious problems with our current workforce housing law, which has resulted in it being rarely used. The proposed approach does not provide a guarantee that this will even yield 15% workforce housing. The developer could find it advantageous to build 2 larger units in a duplex rather than 3 smaller units in a triplex. If they did that, you get 0 affordable units. And then there's the elephant in the room. There are approximately 30,000 housing units already approved to be built. All the developers need to do is go and pull their building permits, and they're ready to go. In the middle of a housing crisis where supposedly there's this dire shortage of housing, you would think the builders would be dying to build the projects that are already approved, but they're not. Beyond that, there are more than 80,000 units that have been zoned into our master plans and can be built as soon as developers decide to submit applications. Instead of building in the smart growth centers that were consciously created to create additional housing, this bill would draw the higher end units away from where that development was intended. If Park and Planning thinks they've zoned for the wrong types of units in these plans, they could reopen the unbuilt master plans and rezone them to create more desirable housing, if this is what they think people want. That requires no redevelopment of existing neighborhoods. Planning decisions were made in the context of smart growth and the focus on development and activity centers, not along scattered roads. These proposals actually have the potential to exacerbate suburban sprawl. I'm also concerned about Bill 2-25E that would give a property tax abatement, a 100% property tax abatement known as a payment in lieu of taxes for 25 years for certain buildings that are at least 50% vacant that can be converted or demolished and then rebuilt into residential units from commercial units. And they would be required to provide some affordable housing, which is what they're required to do anyway if they build new housing. There is no demonstrated nexus between the giveaway of taxes, and particularly the giveaway of taxes at that scale, and the public benefit. In short, the costs of lost revenue is detached from the benefits that might occur. Most important of all is that the taxes that they don't pay will increase the burden on homeowners. Someone has to pay for schools and infrastructure, so what developers don't contribute is going to wind up back on your back. I would also note that the County Council's Office of Legislative Oversight issued a racial equity and social justice impact statement that said, and I quote, "This could widen disparities in housing by race and equity." I will have more specific comments and suggestions going forward, but I do want to encourage residents to engage in this issue. We're working hard to increase housing affordability and choice, but we need to be extremely careful of unanticipated consequences. Actually, we should actually care about what the consequences are. Next Thursday, March 13th, the County Council will hold 2 public hearings, one in the afternoon and one in the evening. This will not be a back and forth discussion, and residents will have a couple of minutes to testify. This is not anything like a public process where people sit around the table and try to work things out. I want to encourage people to engage in these proposals and to let your council members know that you want to be part of the planning process for the benefit of our neighbors, our neighborhoods, and our future. In some good news, I'm glad to share that Montgomery County saw the number of overdose deaths fall in 2024. Overdoses involving opioids were down 48%, while deadly interactions with fentanyl dropped 52%. There were 88 overdose deaths in 2024 compared to 138 deaths in 2023. This represents the lowest number of overdose deaths since 2015. For close to 10 years, we saw a concerning rise in deadly overdoses across Maryland and in the county. The county saw a 188% increase from 2012 to 2023. One of the main culprits was opioids, which accounted for 90% of all intoxication deaths in 2020. In 2021, we saw the most deaths, with 142 of them reported. And last year, we saw fentanyl-laced drugs ignite new concerns about overdoses, especially among young adults and teenagers. We can attribute this reversal to many things, including educational initiatives. Our Department of Health and Human Services was able to speak directly to parents through fentanyl awareness forums in our community, which helped increase awareness about the severity of the problem. Additionally, programs like STEER and the launch of the Crisis Stabilization Room have helped us to intervene and get hundreds of people on the path to care and treatment. We also got a lot more of the anti-overdose medication, Narcan, into our community to help people most likely to be impacted by potentially deadly drugs. There is another result of all this education, awareness, and proliferation of Narcan. We're seeing fewer 911 calls for overdoses and fewer visits to our emergency rooms because of drug use. In 2024, ER visits were down 30%, with a lot of that attributed to fewer overdose cases. Health officials continue to collaborate with schools and the police department on providing more education. However, officials remain concerned about a rise in fentanyl use within specific populations, namely Latino youth and African American men over the age of 55. That is one reason why groups like the Latino Health Initiative and the African American Health Program exist. That's to help reach people who desperately need to receive the message. While we've made significant progress on reducing the number of drug overdoses in Montgomery County, losing just one person is still too many. Think of all the lives impacted by one single person. Many times we don't make that connection until they're gone. Let's celebrate our accomplishments, but also use them to inspire more life-saving work. This is not a time to declare victory. You can learn more about the dangers of opioids and other drugs by going to knowtherisksmc.org. This week, I have the chance to welcome many of our business community to the latest Montgomery County Stakeholders Forum, hosted by our Department of Permitting Services. DPS plays a vital role in keeping projects moving and supporting our local economy. Whether you're building a backyard shed or a high-rise, your projects matter, and DPS is here to make that process smoother, faster, and more transparent. Today, innovations, technology improvements, and customer service enhancements all work to help customers complete projects faster. From online permitting tools to in-person support in Wheaton, DPS is focused on serving you better. They've launched new GIS maps to improve access to property information, and the eSolar program to help streamlining residential solar permitting. DPS has also updated guides to help restaurants open quicker, plus the new permitting dashboard provides transparency around plan review timelines so projects are no longer stuck in limbo. These are changes that our business community asked for. I remember hearing from owners and operators directly during my first year as county executive when Sydney and Katz and I were doing a listening tour around the county that involved 6 different meetings. The county has responded to that listening tour with tools that continue to make it easier to do business in Montgomery County. At this week's forum, key partners like Maryland National Park and Planning Commission, the Department of Housing and Community Affairs, and the Department of Environmental Protection provided updates. Breakout sessions focused on zoning, fire code, and land development changes were also held. Under the leadership of Director Rabia Sabakan, DPS is becoming a world-class department dedicated to exceptional service. We've made progress, but there's more to do, and your input remains a key. I encourage you to visit montgomerycountymd.gov/DPS and discover how we can help meet your needs. There you'll find a DPS Customer Bill of Rights, which emphasizes our commitment to providing excellent customer service here. 5 years ago this week, the Maryland Department of Health notified us that Montgomery County had the first confirmed cases of COVID-19 in the state of Maryland, 3 residents from our county. I remember that day pretty vividly. We knew this virus was coming, but the reality of it hitting our community changed everything. We mobilized immediately, putting together our public health team, emergency response, and health systems to prepare for what was ahead. We didn't have a good idea in that moment of what exactly was ahead. We made the difficult decision to separate people as much as we could because we saw that was the best way to keep the virus from spreading in our community. These were the decisions we revisited several times before vaccines were available. We saw what happened at the start of the pandemic in New York City. Hospitals were overwhelmed and people died at an alarming rate. And I think the most disturbing scenes to me were the ones where people were going into apartment buildings and emerging with dead people in body bags and then put in refrigerator trucks. We were determined that we were going to do everything in our power to prevent that from happening here. And our goal was simple: save as many lives as possible. COVID-19 became one of the biggest challenges this county has ever faced. To date, we've lost more than 2,500 residents, the vast majority of whom are over the age of 65. While many have moved on from the urgency of those early years, for the families who lost loved ones, the pain and trauma doesn't just go away. Between 2020 and 22, COVID-19 accounted for 9% of all deaths in the county, trailing only heart disease and cancer. Many people did not have a chance to be with their loved ones at the end. That kind of trauma lingers and can be haunting. Our thoughts remain with those family members, friends, and colleagues who lost somebody they cared about. What stands out most from our response is how our county came together. Our employees, our residents, and our health professionals, everyone played a role in keeping the community as safe as possible. One of my proudest accomplishments is that Montgomery County led the nation with some of the lowest death rates and highest vaccination rates among large jurisdictions. I always tell people I'm grateful for so many county residents who trust science and believe in medical professionals. While every part of the county government was involved in this response, I especially want to thank our Department of Health and Human Services. Montgomery County is unique in Maryland. We're the only jurisdiction that runs our own health department. Every other county in Baltimore City relies on the state. But here we created our own public health infrastructure, and during the pandemic, those investments saved lives. The pandemic also forced us to confront longstanding inequities in healthcare. The lessons we learned, how we deliver health services, how we support our most vulnerable residents, and even how we communicate with the public, have been shaped by the way we operated during the pandemic and carried into today. We learned from treating patients during the pandemic that many people had other health issues that had gone unaddressed, sometimes for decades, which made recovering from COVID-19 even more difficult. That has prompted us to use clinics and our healthcare partners to help people stay more on top of their health. It encouraged us to increase the investments in public health and also to support more community-facing organizations, because it turned out they had deeper reaches in the community than the county government did. What we experienced 5 years ago still holds true today. Our public health system saves lives and builds a healthier, more resilient community. And we continue working to protect and support all our residents, and we continue working with the partners that grew up beside us during COVID-19. On Sunday, March 2nd, I got to relive my teaching days and shared some stories with children in Silver Spring for Read Across America Day. This is something I look forward to every year, and I want to thank the Jewish Council on Aging for helping to make this event a success. Every year, they pair children and volunteers together to share this day. There was also a reading event in Gaithersburg and the next day in Wheaton. I knew that the volunteers get just as much out of it as the children do. Then on Tuesday, I also got a chance to read to children at the new Central Nia Child Care Facility in Silver Spring. We just launched the Center for Low-Income Working Families last year to help educate children before they're ready for kindergarten. The environment is bilingual and multicultural, which helps more of our families find a safe place for their children to learn and grow. Montgomery County has an incredible library system with thousands of books for kids of all ages, and we continue to invest reading resources and supports in MCPS, like our county's pre-K education infrastructure. Of all the investments we can make, including most of what's in the blueprint, universal pre-K would be the most effective, the most important, and create the greatest benefits compared to anything else. Both the Jewish Council for Aging and the Central Nia have a long history of helping families in our community. Helping to spread the joy of reading is just one way to contribute. I urge you to seek out ways to help these wonderful organizations or others who are helping people throughout Montgomery County. That's a wrap for today. I hope you have a great week, and I'll be back again next week.